Why might I need management of a ruptured ovarian cyst? A lot of bleeding can be caused by ovarian cysts. Blood loss can cause your organs to fail. Ovarian cysts do not break. Some cysts open and some don't. A cyst is more likely to break during sex. If you have a health condition that makes you bleed easily, you will need surgery. There are different types of cysts. Functional cysts are the most common type of cysts. These are only for women who have not gone through a period of menstruation. Laparotomy. If your cyst is large or it is cancer, a laparotomy may be recommended. A larger cut is made in your tummy to give the surgeon better access to the cyst. The cyst and ovary can be removed and sent to a laboratory. You may need to stay in the hospital for a while. What are the risks of management of a ruptured ovarian cyst? A rupturing ovarian cyst cannot cause any symptoms. Pain medicines can be used to manage mild symptoms. You may have more serious symptoms. There is pain in your lower belly. Uncontrollable bleeding can cause life-threatening bleeding. You may need to be hospitalized for some symptoms. Severe cases may need surgery. The surgery may be minimally invasive or open. There are risks to surgery, but there are more risks to avoid. How is an ovarian cyst diagnosed? Your healthcare provider will not rule out pregnancy as the cause of your symptoms. Sound waves can be used to create images of your body's internal organs. It can detect cysts on your ovaries, including their location and whether they are fluid or solid. This is a procedure that is done in the operating room. Your provider can see your reproductive organs with a camera through an incision in your abdomen. What are the different types of ovarian cysts? Follies and luteum cysts are the most common types of cysts. Endometriomas are caused by menstruation. The uterus has a lining that grows outside of it. They can grow to 4 inches in length. They can cause pain by twisting the ovary. They are usually benign and go away in a few months. Some medicines can cause cysts. They can be treated with drugs. Ovarian cysts and fertility. It's not usually a problem for women to get pregnant if they have ovarian cysts. If you need an operation to remove cysts, your surgeon will try to preserve your fertility. This could mean removing the cyst and leaving the ovaries intact. If you have your ovaries removed, you won't be able to produce eggs. Your fertility. If you have been through the menopause, your ovaries may be removed. This causes an early menopause and means you no longer produce eggs. If you need to remove one of your ovaries, the remaining ovary will still release hormones and eggs. It is not likely that your fertility will be affected. A baby can be born with a donated egg. This will need to be discussed with specialists at a center that is specialized in assisted reproduction techniques. Before you go in for the surgery, make sure you tell your surgeon about your fertility concerns. If you want to have history in surgery, you should talk to your surgeon about the risks and benefits. Pregnancy and ovarian yeast. A fertilized egg implants outside of the uterus. It is usually found in the fallopian tubes, but on rare occasions it implants on an ovary. Ovarian cysts are not unusual during the first few weeks of your baby's life. The hormones produced by this cyst help sustain the baby. What are possible complications of an ovarian cyst? An ovarian cyst can sometimes break open, but it may not cause any symptoms. It could cause a big pain in the lower belly. Low blood pressure can be caused by this. In some cases, surgery is required. It can cause a problem with the fallopian tube. This can cause the blood supply to be disrupted. Monitoring ovarian yeast. If you have been diagnosed with an ovarian cyst, your healthcare provider will recommend regular checkups and scans to monitor the cyst's growth rate. If you have a cyst that does not resolve on its own, more frequent monitoring is recommended. If you experience abdominal pain, a high temperature, rapid breathing, or symptoms of shock, you need to seek medical attention. Ovarian cyst treatment. Ovarian cysts need surgery. Your doctor can give you medicine. If you are near menopause, you could need surgery if you have cysts. Laparoscopy is a type of surgery. A camera and a small tool allow your doctor to see inside the cyst. Laparotomy is done with a bigger cut in the belly for cysts that may be cancer. Prevention of ovarian cysts. Ovarian cysts are not usually cancer-causing. Ovarian cyst symptoms can be similar to those of ovarian cancer. If you have any of the symptoms, you should alert a doctor. The development of new cysts can be prevented with oral contraceptives. Postmenopause females are more likely to be diagnosed with ovarian cancer. Researchers found that combining supplements of the two drugs may help support healthy weight and hormone levels in rats. What is the difference between an ovarian cyst and ovarian cancer? Ovarian cysts are sacs or pockets of regular tissues or cells, and are usually filled with fluid. Ovarian cyst pain can be similar to abdominal pain or intercourse pain. There are symptoms of bloated abdomen. A study found that 6.5% of people with ovarian cysts may be diagnosed with ovarian cancer within 3 years if they are 50 or older. The risk of cancer in people with ovarian cysts was 4% to 6.6%. Ovarian cysts can often resolve on their own. Cysts can be found through a gynecologist or primary care physician's exams. When should I call my healthcare provider? If your periods are late, irregular, or painful, you should call your healthcare provider. If your provider finds an ovarian cyst, it's usually harmless. It is possible that your cyst is a natural part of your menstrual cycle and will go away within a month or two. If your provider finds a cyst that is concerning, follow their recommendations. If you notice signs of ovarian torsion, get help. It feels lightheaded or faint, called clammy skin. You have pain during sex. You lose weight for no reason. Thank you for watching. Do subscribe, like, and share.